we're going to look at the lesions in the optic pathway. So firstly, to start off with questions, the first question is in case of the optic nerve. In case of the optic nerve head, that is unilateral. So what will be the defect of the eye? The second question is in case of the inner optic nerve. So inner optic nerve, this will be unilateral. So here, what is the defect of the eye? And the third question is in case of the proximal, in case of the proximal part of the optic nerve. So in case of the proximal part of the optic nerve, what is the eye defect? So we'll find out all these answers in this video, and in the end of the video there are some bonus questions as well. So first, to start with, we look at in case of the optic nerve head. That will be in case of unilateral. So here the defect, it results in the big blind spot. It results in the big blind spot. So the next one, we look at the optic nerve, that is in case of unilateral. So here what we see is in case of optic nerve, there is a tunnel vision that is produced. Third, moving on, we look at the inner optic nerve. So inner optic nerve, this will be unilateral. So in case of inner optic nerve being unilateral, here the defect lies in it produces a central scotoma. A central scotoma is produced in case of the inner optic nerve. Whereas in case of just the optic nerve unilateral, it was a tunnel vision that was produced. Now moving ahead, we look at the whole optic nerve. The whole of the optic nerve. So whole of the optic nerve, we are looking at unilateral. So in case of the whole of the optic nerve, that is unilateral, we have the unilateral blindness. Next, moving ahead, we look at the proximal part. So this is nothing but the proximal part of the optic nerve. So in case of the damage here, it results in the junctional. It results in the junctional scotoma. Then we move on to the central chiasma. So in case of the central chiasma, what is the defect? So in the central chiasma, and we call it bilateral. So it is a bilateral lesion. So here this leads to the bitemporal hemianopia. Leads to the bitemporal hemianopia. Then we move on to the seventh one. The next one is in case of the early pituitary adenoma. So in such case, the early pituitary adenoma, it results in the bilateral temporal. So bilateral temporal superior quadrantenopia. So bilateral temporal superior quadrantenopia. Next we move on to the next one. So here in case of the early craniopharyngioma. So in case of early craniopharyngioma, there is the bilateral temporal, and here it is inferior, temporal inferior quadrantenopia. Then we move on to the next one, that is the lateral chiasma. So what about lateral chiasma? So lateral chiasma bilateral. So this leads to the binasal hemianopia. So it leads to the binasal hemianopia. And next we look at the optic tract. The optic tract, that is bilateral. So here this results in the bilateral homonymous hemianopia. So bilateral homonymous hemianopia. Next we look at the lesion in the lateral geniculate body. So the lateral geniculate body, it can lead to the right contralateral homonymous hemianopia. Next we will look at the lesion in the optic radiation in the temporal lobe. The temporal lobe, that is the Mayer's loop, or in the anterior bundle. So in such case, there is pie in the sky. Then we also have the contralateral superior quadrantanopia. Next, we look at the optic radiations. Then we look at the optic radiation, and this is in nothing but in the parietal lobe. This will be in the parietal lobe, and the Baum's loop, or the posterior bundle. So this is nothing but there is pi on floor. There is pi on floor, and there is a contralateral inferior quadrantanopia. Next, we move on to the optic radiations. So in case of optic radiations, this includes the right contralateral homonymous hemianopia. Next question, the next we are going to look at the visual. The visual cortex is sparing the macula. So what does this lead to? This leads to the right contralateral homonymous hemianopia, and this is with the macula sparing. Then we move on to the visual cortex. So there's a lesion in the visual cortex, and only the macula is involved. So here it appears as there is a cookie cutter effect. It is known as a cookie cutter effect. That is, there is a right contralateral homonymous macular defect. Then we look at the bilateral visual cortex, or and only the macula. So this is nothing but there is a bilateral homonymous macular defect. So this was about the optic lesions. Now we are going to answer our questions. So the first question we asked was, what is the defect in case of the lesion to the optic nerve head? So optic nerve head, what are the lesions in case of unilateral? So here the lesion is nothing but there's a big blind spot. Now the next question we asked was, in case of the inner optic nerve. So in case of the inner optic nerve, that is unilateral, what is the lesion? So what is the eye defect? It is nothing but there is a central scotoma that is seen. Now answering the third question. The third question we asked was, in case of a proximal part, this is of the optic nerve, proximal part of the optic nerve. Here the defect was nothing but there is a junctional scotoma. Whereas in case of inner optic nerve, it was central scotoma. So now we'll move on to some bonus questions which you can answer in the comments. So in case of the bonus questions, the first one we want to ask is, in case of the optic nerve lesion that is unilateral, what will be the defect in the eye? The second one is, in case of the whole optic nerve that is unilateral, what is the defect? Third one is, in case of optic radiation, lesion in the optic radiations, what will be the defect? So you can write these answers in the comments.